Welcome to the second episode of We Think Out Loud. I'm your host, Uli Cartwright. Today, we're talking to a CEO of an Australian service provider, Yooralla. We unpack and speak about the complexities of running a good service, especially when things go wrong. We speak about how his experience from the healthcare sector translates into disability care and service. Speak about advocacy, and obviously we speak about the gag laws. So I hope you enjoy my conversation with Terry Symonds from Yooralla. Welcome to the second episode of We Think Out Loud. I am sitting down with Terry, the CEO of Yooralla. Thank you for joining me.
Thank you for having me. Great to talk.
How are you?
I'm fantastic, thank you. How are
You're
you?
good. I'm tired and exhausted, but we will unpack why that might be. Now, for some audience members that don't know you, tell me about you. Because we've met like once or twice, but I don't know much.
Sure.
Tell us.
Thanks, Uli. Great to be with you, and I'll just acknowledge that you and I are sitting together in Yooralla's office. We're on Wurundjeri country, and acknowledge the traditional owners and pay respects to elders past, present, emerging. So I'm the CEO of Yooralla. I've been CEO for about 2.5 years. Before that, I worked in state government in health and human services. And then before that, a career that goes back across kind of health services, and actually began my professional career in disability services in Queensland, which is where I grew up and where a lot of my family still lives. So that's a little bit about me.
Awesome. What are your challenges?
What are the challenges? So look, I mean, any service provider in the NDIS will tell you that balancing the books is a challenge. And that just comes with the territory. Like we're spending taxpayers' money for the benefit of people with disabilities. That kind of always should be a bit challenging, in my opinion. What's
predominantly like your service? Is it one-on-one support, or is it like housing that you guys do now?
We do a pretty wide range. So we provide supports in housing across Victoria. We have employment services. We support people one-on-one in the community. We have centre-based programs. We have therapy teams. So we have clinicians providing the whole range. So it's a pretty wide range of services. And the NDIA and the NDIS expects that we don't waste money, So they keep it hard for us because they want to make sure every dollar is going for the benefit of people with disability, and that keeps it challenging for us. So that's like I say, that's kind of part of the territory, I think.
So what about from the books are difficult for everyone, but what about from a culture perspective or from a parent-client perspective? What do you find the challenge being the most?
Yeah. I mean,
it doesn't have to be bad, but it can also be something that's good you're working through, but you find difficult.
Sure. Well, look, I'll share something with you. So Yooralla's probably Victoria's oldest disability provider. We've been around for 105 years. One of the good things about being around for a long time is you become part of the community. There are people who've got very long-term relationships with us. I've met people who've been, kind of getting support from Yooralla longer than I've been alive.
Wow.
But the downside of being around for a long time is it can be easy to fall into, as an organisation, thinking that the way we've always done things is therefore the way things have to be. And so sometimes change can be a little harder in an organisation that's been around for a long time.
I'm glad you're saying it.
So, so there's good and bad.
How are you doing that, briefly? How are you doing that?
Bit by bit is what I would say.
Okay.
It's. I think you have to start by saying how you want to be. What kind of relationship do we want to have with people with disabilities and families? What kind of services do we want to offer? And then accept that it's going to be a bit of a journey to get there. We're not going to get there overnight, and it's going to take some people longer to get there than others. And so we have to try and bring people with us on that journey. And that applies to families as well as staff and clients. There are some people who who are very attached to the models of support that they have been getting for a long time. And if we say we want to change things up, or the Royal Commission says we want to change things up, those people can get a bit kind of fearful. I'll give you an example. We had a forum last night with clients and families, and I talked about the NDIS review. And I said that one of the things coming out of the NDIS review, like the Royal Commission, is a move away from group homes towards alternative models of housing. But there are people in last night's call who've been living in group homes for decades, and their question back is, where am I going to live? And I have to reassure them and say,
somewhere.
And say, you can live exactly where you're living. No one's kicking you out of a house. What we're talking about is providing more choice, probably more choice than you had when you first moved into the group home, but it's still a choice. And so if you're happy where you are and you're living with people that you want to live with, nobody wants to change that. What we want to do is give choices to people who haven't had choices, and maybe change the situation where group homes were the only thing on offer for people.
And it could be as simple. I had someone from a different service tell me last night. One of the participants turned around and said they love being in a group home, and it was because their staff are great. So it might not necessarily be the group home itself. It might be the support they're receiving. So it's all different, degrees of opinions.
And I think it's fantastic if people are living with people that they choose to live with in the place where they want to live, and they're getting supports from people they're happy with, then nothing needs to change for those people. My concern, and the concern of the Royal Commission and the NDIS reviewers, is people who want to live independently but are told the only place you can live is with people that you don't know, who you don't choose, and get support from people you don't choose.
Doesn't make sense.
That's not ideal for people, and we want to make sure that's not the only option for people. So,
Now I'm gonna let's unpack this next thing. It's not even on our list, but you're talking about some people. Some people might be aware, might have a mindset. What would you tell not to the parents that you support, but just in general? How would you encourage them to shift it? Because it's honestly, I'm always reluctant to speak about the attitudinal barriers that we're stuck in, because it gets me really angry and really frustrated, and I don't think I'll ever be productive. So what would you tell them? And what would you tell people with disability that might be trying to do stuff but are being held back? I don't know, man. Like, I know it's a loaded question, but how would you answer it? Because I don't know.
I mean, look, the simple starting point is we start with what it is that people want. If they don't, it is not my job to convince someone that what they've got is not what they want, or that they should want something different. So, like I say, if there are people who are happy with what they've got, I don't need to try and convince them otherwise. But people who do want to change and are being held back, then that's very different. And I think then we have to do everything possible to help get those people to where they want to be. And that may not be with us. It might be with other providers. It might be with different supports, or less support, or more support, whatever that is.
Are you saying, for example, Yooralla has a responsibility to help a participant to have a new way of doing things, even if they're significant trusted person in their life might think otherwise? Like, how do you navigate that? Like, obviously you can only do so much, but are you saying that Yooralla, or services in general, should step up a bit more in that support to people with disability?
Oh, absolutely.
Okay.
I think we're sort of at the beginning of a long journey, I think. I don't think our job is just providing support. Our job is supporting choice and control and autonomy and people's human rights to choose. So if somebody comes and says, my job is helping someone go to the bathroom or wake up in the morning or go out the door, I go, look, that's part of your job if that's what people are asking for, but you always have another job, which is understanding what it is that people want and thinking about how you can help them get what they want. So it's not just kind of a set of tasks. It's also getting to know the person and thinking about what more we can do to help them with their choices. So
Wow. Most services don't say that. Like, it makes sense. That's what I think.
Yeah, I mean, it's...
But most services are too scared to, meddle, so to speak. There's a responsibility. Let's not get too personal into their stuff. Let them, because if we make a mistake, it'll be blamed on us. But it's an interesting approach.
I mean, of course, lots of clients don't need us to kind of to sort of meddle, so to speak.
Yeah.
But I do think it's part of our job to not just deliver a service,
but guide them if they want.
Not even guide them, but understand them. And so perhaps if I give you an example, like I was at a meeting with a bunch of residents in a house who were, and we started talking about choices in housing, and they were initially very concerned that the move away from group homes might mean that they lose their home and lose where they're living. And we reassured them that wasn't the case. But it became clear during the conversation that they didn't actually know all of the other options and alternatives they might have. And so as we got to talking, they said, well, theoretically, like if I wanted to find out about alternative housing and homes, could I do that? And we said, yeah, absolutely. Well, we can arrange for someone who's not Yooralla to come in and actually just sit down with you and go through the range of choices that you've got. And at least then you know what the alternatives are. And if at the end of that you still choose to stay where you are, that is absolutely completely your choice.
And that's what you call advocacy services, Well,
it's informing choice. It's, and so I think it's not. Again, it's not my job to tell that person they want to leave. Our job is to help them understand their choices and then support their choices. And in this case, they didn't have enough information, I think, to make an informed choice. So in that case, our job is to arrange for that information.
I don't think many people do. So, that's why that's part of the reason why we're stuck in the atmosphere that we're in. That people don't know what you don't know. So how can people with disability make choices if they haven't been told?
Yeah. And sometimes it needs experience. I'll give you another example to do with work. Is I've met many people who work in supported employment or what used to be called sheltered workshops, and they've worked there for a long time. And if you ask these people, these workers, if they're happy where they are, they'll say, yes, I'm very happy where I am. I'm enjoying my job. I enjoy my workplace. Have you experienced other jobs, other workplaces? No. So I understand that you're happy where you are.
Do you want to experience other workplaces?
That's right. But we can arrange for people to get experience doing other things, and it's like all of us. I mean, all of us start our when we become adults, we kind of you go and get different experiences. It's part of what growing up and becoming an adult's all about, and you get different experiences, and then you're able to make informed choices about those things. And so it's not just information for people, but offering them alternative experiences, not making anyone do anything, but offering alternative experiences, so then they can learn about themselves and about the options they've got.
Interesting. And also your management team, very diverse. How does that work?
So everyone comes from different backgrounds. So if I think about our team, so one person in our team has been working for almost 30 years in the disability sector. Another person comes from health. Another person comes from the non-profit sector, the homeless and welfare services. Another person comes from the arts community. So it's quite a diverse group in there.
I find it intriguing. That's why I'm asking. It's interesting.
And everyone's got their own journeys to kind of get to where they're. But I think what the team has in common is an absolute commitment to the purpose of the organisation. So they all get a kick out of supporting choice and equity for people with disability, and we've spent a lot of time unpacking what it is personally for each of us that drives us and what we have in common. And it makes it fantastic as a team to work in. In terms of what I've learned from health, I mean, for a start, health is a big deal for all of our clients. I mean, I don't know if there are many people with disability who are not experts in the health system by their own experience. They know a lot more about the health system than I ever will because they use it on a regular basis.
Probably a bit too much.
A bit too much, and they probably had both good and bad experiences with the health system.
Yep.
So they've learned that way. So health's a big deal, and we can do things to, as a provider, a disability support provider, to help our clients have a better experience in the health system.
Yep.
So I'll give you an example. Is one of our clients who has challenges communicating, doesn't speak to communicate, went to a hospital. The hospital did not welcome her family member who supported her to communicate, and did not bring her on the journey, did not fully involve her in the decision making. And if they don't involve that carer in the decision making, the hospital didn't realise, I think, or didn't appreciate that in the process of cutting off that support, they're actually cutting off a channel of communication to the person themselves.
Yeah.
And that supporter has to be on the journey with the patient to give the patient the best experience. And so as a result, mistakes were made in the patient's care. And then later on, the family reached out to us and said, can you help? And so our team then went and conducted educational sessions for all the staff at the hospital to explain what supported communication is and why it is that carers need to be in the room for people who don't use speech to communicate necessarily, to help them drive and control their healthcare.
That's a benefit of having people from the health sector in an organisation. You know what to do. You knew how to get in there, and you just did it.
Yeah, and the person who went and delivered the educational sessions for their staff was a nurse themselves.
Awesome.
And so it is like a lot of sectors and organisations. They probably took the message better coming from another health professional, and it just happened that this health professional also has experience of disability, which is kind of handy. So that's an example. So the interface with the health system is certainly something that we bring. And again, my experience in government's probably helpful because the NDIS is a government funded scheme. It exists under laws. It's got taxpayers' money involved, so it doesn't hurt to kind of understand the way those big government schemes work, move or don't move.
How does you and your team deal with dignity of risk, in the sense that obviously I would assume in the healthcare sector you're trying to preserve life and take the least amount of risk, and obviously you do that in this role, but it's a different tolerance. How did you change that? Did you have to change it? Did you have to go through a growth period when you came into this sector where it's not as urgent and frantic and people have the right to take risks? Was it hard?
I don't think it's hard, but the change is real.
Yeah.
And it's a great question. So I don't think, for example, in this sector, our job should be to kind of ensure that people take the least possible risk. The least possible risk is a pretty boring life, and it's a life in which you don't grow and you don't learn.
Yep.
So I don't think the least possible risk is the right approach. I think the greatest possible choice and control, so people understand the risks and make informed decisions about the risks they're taking, and then we put supports around them if that's what's needed or what they want, to try to kind of mitigate the risk in some way. That's probably the best way of putting it. I think the sector and health organisations do. You're right. Health organisations do generally work on like I said before, on the basis of safety.
Yep.
Lowest possible risk. Do no harm. That's kind of where they start. Now, absolutely, we also aim to do no harm to who though. Yeah. But risk is important, and I think it's something I think we are on a journey to fully appreciate. Is that risk is healthy. Risk is something that we all take in our lives. It's how we grow, and supporting clients to take risks is actually part of our job. Making sure those risks don't cause harm to clients or others is also part of our job.
Probably unnecessary harm, because there's harm to everything when you take a risk, I guess. But yeah.
And so that ranges from choices in what people eat, to choices to travel, to choices in work. There's risk in all of those things.
Yep.
But it's how people learn and grow. So,
last question. What does advocacy mean to you? Well, last question for this introduction bit. What does advocacy mean to you? And how does Yooralla incorporate advocacy into the organisation? I think we spoke about it earlier.
Yeah.
Is it just about choice and, giving people understanding and sort of... What else? What else do you guys do?
Well, it's also about defending rights. You know, so as well as choice, I think it's about rights. And I do think that, and I guess there's a couple of points I'd make about advocacy. First is that there's a really important role for independent advocacy, not from service providers, but from people who are not providing funded services. So we have a role to play, but we also want to make sure that people have access to advice from someone else. Once upon a time, I suppose service providers like Yooralla, we were everything in some people's lives, and that's not safe.
Yep.
You know, people need access to independent advice so they can question supports they're getting, question organisations they get supports from. They need someone who's not providing supports to be on their shoulder and kind of ask questions and help them ask questions. However, because we are in people's lives, we also have an advocacy role. If we see people's rights being threatened or risks to people's rights, then I think it is our job to speak up. And that applies to whether they are children in early childhood settings, being isolated or being disciplined because of the centre or the program's inability to deal with their impairments or their behaviour, then that's about the rights of the child. But it also applies to rights at work for adults. It applies to rights in the home to have control. Our job is to defend those rights as much as possible, as well as connecting people to other advocates. So we do have, for example, at Yooralla, a team comprised only of people with disabilities, led by people with disabilities, who spend a lot of their time talking to our clients when they've got concerns and trying to connect those clients either to other supports or to help them fix whatever's going wrong inside Yooralla. So
that's cool.
Yeah, it's not a substitute for independent supports, but it's a good little kind of radar and valve inside the organisation for when we get things wrong. But there are people who know what it's like to live with a disability, who can listen and kind of hear and understand, and then advocate inside the organisation for change.
Yeah, I think advocacy in that sort of approach goes with the attitudinal stuff that we were talking about earlier. I think they can hinder each other but also help each other at the same time.
Yeah, for sure.
All right, let's get into the stuff. Yooralla's past. I'm going to give you some context to the listeners. Some listeners may be aware of the past controversy associated with Yooralla many years ago and the multiple cases of violence, abuse, neglect that occurred against people with disability in Yooralla's care. So, obviously it goes without saying, we're going to get into some nitty-gritties, but we're going to be careful with our words because out of respect to people that might be listening that can relate to it and just people, that were involved in it. It's more about the attitudes and the approach and the importance of how it got dealt with more than what the actual case is. But we are going to get into some pretty not nice things, you could call it. Yeah? Were you aware of the incidents prior to you starting?
Yes, I was aware. So
okay.
Obviously I've learned.
Why did you decide to come into it?
Yeah, well, let me answer that question this way.
Yeah.
If I had believed that violence, abuse and neglect only happens because of bad people in bad organisations, I could have just chosen a different organisation and walked away from Yooralla.
Yep.
But because I think violence, abuse, neglect and exploitation don't just happen because of bad people, but they happen because of discrimination, they happen because of inequality, they happen because of structures and systems that cause abuse, neglect and exploitation and allow it, then just walking away from one organisation isn't going to avoid abuse and neglect.
Yep.
Every single organisation in our sector is part of a system that allows and enables abuse, neglect and exploitation. And on the first day of every new staff member's time at Yooralla, I stand in front of them and I say abuse and neglect wasn't just a bunch of bad things that happened years ago. It is something that is happening today in Yooralla and across the entire sector. And we've had Royal Commissions tell us how and why that happens. And it is your job as staff of Yooralla to be on the lookout for it and do everything possible to avoid it. And you're not just on the lookout for bad people, you're on the lookout for even...
bad vibes.
But sometimes even good intentions.
Yeah.
Even out of good intentions, you will compromise the rights of people with disabilities.
Yeah, it's true.
And you've got to be mindful of that. So I guess the way I'd answer your question is to say, I came to Yooralla because knowing that abuse had occurred, I also understood this is an organisation that is trying to change, had put in place some things to change, lots of change still to happen, but it was an organisation that accepted responsibility for what had happened and the responsibility to do something about it. That's what made the difference for me.
Wow. What, in your opinion, allows for abuse against people with disability to occur, and how can these be prevented? I think you kind of just touched on it.
Yeah. Silence is something that allows abuse to occur.
Okay.
So if we don't allow people to communicate, if we don't listen when they communicate, if we don't document and value what it is they choose, then I think we're allowing abuse to occur.
How do you do that when other services are too scared for people to be unsilenced because they feel like, for example, a different service might get someone to speak out and they don't want them to because they don't know what the answer is. They don't know how to help, or, they'll look bad. That's a very ballsy thing to do, the right thing to do, but how do you do that? Like, how do you take a big gulp? It's just like, all right, we might be hearing something pretty terrible.
Yeah. Look, I suppose I'll say my experience is that other organisations are up for this, and all of us get it right some of the time and get it wrong some of the time, and that's still the case. So, I have to say, when I meet with other providers, I feel like we are all trying to listen and do better, and putting in place steps to value what it is people are saying, including trying to keep people safe. So I don't feel out of whack with where the rest of the sector is. And obviously, I hope obviously we don't get it right most of the time now either. Like, there are still cases of where clients and families have to speak up and say, I wasn't heard, I haven't, I asked for this, or I feel like I'm trying for this and I'm not getting what it is that I want, so they have to push a bit harder about it. And so we're still on a journey ourselves. I think we can all put in place steps that allow people to communicate better and allow us to listen better. So I'll give you an example. We have our board is meeting next week, and we have a policy on supported decision making, which is going to the board. That policy will...
shout out to these guys. I asked them to do it. They did it.
Shout out to Uli for your help in drafting the policy. So that policy will require staff to assume that every client has capacity to make decisions and put in place every possible support for them to achieve what it is they decide. That it hasn't been said in quite that way in the past. Lots of people have done that in practice. Lots of people have tried to do that in the past. But the policy makes it a little bit clearer. And so when
it makes it a lot clearer.
Great, thank you.
I've read it.
Okay.
There's no. You can't get around what you're trying to say.
Okay, well,
it's pretty clear.
Okay, well, thanks for your help. Thanks for your help in making that clearer. But again, that won't be a guarantee.
No.
Not every policy gets followed all the time.
No.
But a policy is a way of communicating to staff what it is they should be doing and what it is we're trying to do. And so that policy will help, because I hope that staff read the policy and go, okay, well, that's my guide to what I do, and it's clearer than it was before. Again, not a guarantee, but it's a little step we can take to set the right expectations. And also, We have a community of practice that involves our staff working through challenges in implementing that policy. So it's a practical way of helping people put that policy into place. So they're little steps we can make, not guarantees, just little steps. So.
Following the DRC and the experiences of abuse that many people with disabilities shared, what do you believe the sector could improve to ensure the human rights of people with disability are maintained? Some services did good through that experiences, and some services did horrible optically. But, it all goes back to human rights.
And the Royal Commission heard a lot about things that went wrong on our watch at Yooralla. So we certainly rightly got our share of criticism over things that have been done in the past. You
were at the helm for some of that? For the DRC? Or was it afterwards?
No, I mean, I'm at the helm now and we are still on our journey. So
but like, were you, obviously you were dealing with the fallout and you didn't deal with it when the cases took place, but were you at the helm when the Yooralla was being grilled at the DRC?
So I had a hearing at the Royal Commission. I gave evidence at the Royal Commission at the beginning of 2023, so this year. Okay. And my predecessor gave evidence 3 or 4 years before that. So Yooralla was on the stand at the beginning of the Royal Commission in its first or second hearing, and then we were on the stand for almost the last public hearing of the Royal Commission. So kind of both ends of the journey, I suppose. And I guess in the first hearing, there was a lot heard about our failings as an organisation. And I hope in the second hearing we also got to talk through some of the things we're doing to try to make things better. Some of those things, to answer your question, that we can do to prevent abuse include supported decision making as an example. It includes putting people with disability into every level of the organisation so that we're hearing and understanding more of the experience of people with disability. It includes safeguards around, for example, investigations of things that go wrong. It also includes responding to abuse after it's occurred, so in the form of redress, for example, and doing everything we can to support people on their journey after something's gone wrong to try and put it right, including by listening to them about what it is they want, apologising genuinely for things that have gone wrong, providing funding or other supports to them if that helps to make things right, and really never forgetting when things have gone wrong. For people who have survived abuse, this is the journey they'll be on for the rest of their lives, and it's a journey we will be on also with them, so never forgetting.
I think your redress scheme, and the reason why I asked to have you on the podcast was a while ago I'm still a part of Valid, but you went to Valid to get an opinion from people with lived experience about the redress scheme, and it was basic and, good and clear, but there was a bit in there that, I don't know what the exact words, but it suggested that, like, we will help you access independent lawyers and legal advice, and also we won't silence you from speaking about what redress we give you. Like, we won't, silence you from, if you do get a redress, you can speak about it. We're not going to shun it. And I think that part was just like, all right, they've made some pretty, big strides. And, some people might think it's not important, but it's clear as day. You're not going to shy away. If we give you redress, as long as you're sticking to the facts, go talk to people. Yeah, we did it. It happened. It's, not that you're proud of it, but it's there.
Yeah, well, I mean, like I said before, Uli, and I think you're in many ways you have demonstrated this. Silence allows further abuse to occur, and so silencing people enables things to go on unchecked. So, from our point of view, there's nothing to be gained from that. It's and again, thanks for your contributions through Valid. It was very important to us to get an opinion from people with disabilities, including survivors of abuse and families of people who'd survived abuse. And we knew that we weren't the right people to ask those questions. It was important for an independent organisation to go and get that advice and then feed that advice back to us. And so Valid did that for us and gave us feedback on the policy, which helped us improve the policy. So it was great.
And, for a bit of context, I was under your foster care program back in the day. But do you still do foster care? No,
we don't do foster care anymore, Uli, and
it's good. There's a reason for it. There's a reason why you don't do it.
Oh well, look, Yooralla used to kind of run schools, early childhood education. We used to do a whole range of things, and we don't do those now. I think we've kind of moved with the times. I have nothing. We still need foster care. We still need early childhood settings, etc. But we're probably not the right people to be doing that right now. So
yeah, cool. Alrighty. What is required, in your opinion, for organisations to build trust following cases of abuse? And then I think the last two, does your past impact the way you lead your team, and how do you recover from the reputation damage that you've caused?
Yeah. So the most important thing that we understand for people who have survived abuse is to put them back in control. And listen to them and be guided by them about what it is they need. And that might mean time, so it might mean they choose to not engage with us for a long period of time and then engage later. So they have to control the timing of the process. They have to control the terms on which it happens. They may choose to engage directly with us or not directly with us or through others. That control is the most important thing in terms of building trust. And so we're in the hands of survivors as to how that process happens, and we need to listen as hard as we can for what it is they want from that process. And that's really what our redress policy is about. And as you said, it does include connecting people to independent supports, because at that point in those conversations, we're not independent. We have been part of a terrible crime for those people, and we have a job to do in terms of supporting their recovery, but they've got to have other people giving them advice and support around how that process should run, and we should just kind of play our part in that process.
How do you lead your team with that in mind, with the impact that it caused?
Yeah, so our team needs support as well. There are many people who work in Yooralla who have witnessed or been part of things that are unpleasant, and that is true across the disability sector. Those people themselves have the best of intentions, but they have been affected by things that have gone on as well. So providing support to them is important. So every time this issue comes up, we also provide support to our staff. The other thing is we try and train our staff. So we have commenced support training for staff around what's called trauma-informed practice, which is trying to understand the perspective of people who've survived abuse or bad things. And we're providing training to our staff in that, because really it's not just about abuse or not just about the terrible cases of sexual abuse. I suppose I've kind of heard about traumatic experiences in the lives of almost all of the clients I've spoken to at one point or another. It may be to do with their childhood, it might be to do with their experience getting disability supports. But I think if we understand that there's been, because of discrimination or because of inequalities, there have been terrible experiences for lots of people with disability that have traumatic impacts, then our staff need to understand how those things might roll on through people's lives and how then we have to work with them in order to give them back as much control as possible. So we've started training in that as a way of supporting our staff.
Do we get the reputations come back?
Look, I don't think anyone should forget what has happened at Yooralla. We are not trying to sweep anything under the carpet. I hope that Yooralla's reputation becomes one of an organisation that has in the past allowed abuse to occur, has learned from abuse, and is working with survivors in the disability community to try and put things right and prevent abuse in future. That's the reputation that I hope for us.
And I think I asked listeners, if you haven't worked it out already, the cases are around sexual abuse. Don't go Google it. You don't need to give more publicity to the people that committed it. They got the justice that they deserve. Don't give the people more airtime. Now, I have to ask you again. I asked you last time we spoke. Do you think Yooralla deserved the Office of the Public Advocate Award? after what we've just spoken about? I think they got it last year or the year before.
So it was the year before I started. The Office of the Public Advocate gave a Human Rights Award to Yooralla.
Yeah.
And I think that award was in recognition of steps that Yooralla had taken to prevent further abuse. And I have no problem, as I said before, with learning from mistakes and trying to put things right. I'm not going to offer an opinion about whether the Public Advocates Award was right or not, but I don't think I think the job of all disability providers is to understand what's occurred in the past in their own organisations and across the sector, and the Royal Commission's given us a pretty good look at that, and then put steps in place to get it right. And those providers that are doing the right thing now, we're happy to learn from them. I wouldn't want anyone to think that any award ever diminishes, what has happened at Yooralla in the past, or the scale of what we've got to do in future to put things right. So I don't think much about the award. No one talks about the award. No one's kind of high-fiving over it.
But I think from a person with disability, it's just like it kind of feels, icky. But again, I've been fortunate enough to not be through sexual abuse, so it's not my opinion to have. But I don't know.
I completely understand that. Uli, I've been here 2.5 years. I haven't once referred to that award in any public statements I've made. I hope people judge us for what we do from here on in, not for any recognition or kind of awards that have been given in the past.
Last but not least, if you haven't noticed already, listeners, you have a current campaign to change the gag laws in Victoria, which I asked you to, and you went one step further and did a supportive decision-making statement. Actually, no. Yeah, you did. Supportive decision-making statement. And, released a statement about your opinions about changing the gag laws. Let's talk about that. What's your opinion on the gag laws?
Well, if we want to learn from people with disabilities, we're not going to do much learning if they can't talk about their experience. So
that's pretty clear, yep.
So that's the first thing is, and I've learned from you as you've talked about your experience of guardianship, and I would not have learned if I hadn't been able to hear you talk about it. So from my point of view, it's important the community understands that. The second thing is that the way in which guardianship's been applied has not always been appropriate, and so it's not just a general point of we should listen to people with disabilities, but actually we have a problem, which is that the way the guardianship laws are administered does take away people's human rights. I'm not qualified, and luckily I don't have to form a view about whether the law should exist or not. I've heard advocates say that the guardianship laws themselves are a problem, and I understand that view. My concern is that the way in which the laws have been applied, the way in which applications have been made, the way in which orders have been applied has unnecessarily compromised people's rights for choice and control over their lives. And we won't fix that problem if we can't understand how that's happened and what impact it's had on people. So that's why the default provisions in the law that do not allow people to speak should be removed.
Yeah, it's just so much to unpack. Like, I wrote all the questions here, but it's just like, as Colleen said in my first podcast, a wrap up. What are we challenging? What's the biggest problem? And she's just like, it's attitudinal barriers. It comes from a time where it was risk adverse. It wasn't human rights embedded. And I think we spoke about earlier about some people not knowing any different, so that's what they believe in. And as you get older in life, you get more stubborn. Anyone inside the sector, parent, not parent, disability or not disability. So why do you think it's important? How do we manage that risk of not knowing what someone might say? Why is it important to? And what supportive decision making? What part that plays?
Well, I mean, some of this, to be honest.
And the $1 million question is who has the right to tell their story? That's the real crux of the problem.
Well, let's. Yeah. To my mind, that's an easy question. I think everyone's got a right to tell their story. No one's got a right to stop someone telling their story because there's something to learn in everyone's experience. The part of the issue with the laws is a little bit to do with sort of medical and social models of disability, because the law is used in such a way that we have to question whether or not people have capacity to make decision-making, as though it's something we can test, as though it's like a medical test. Do you have capacity for this? Have you got capacity for that? Whereas actually the law itself, this is not the way it's understood, but the law itself actually includes statements in there to say that people should, as much as possible, get the supports they need to make decisions. And if we accept that, then actually it's the lack of support, not someone's impairments or capacity, that is the issue. It's how much support do they need and how do we get that support to people to make decisions. I make lots of decisions in my own life. I'm not qualified on my own to understand or make all of those, so I get help and advice. If I have a legal problem, I get advice from lawyers. If I have a financial problem, I get advice from people who understand money. That's support that I get to make decisions. It's just a question of degrees about how much support it is that people need. And I think if we accept that, then I think that's the most productive space. Whereas the guardianship laws are used in such a way, or understood to be, a protective mechanism for people who don't have capacity, so to speak, to make decisions. And so people go first to the issue of do you or don't you have capacity, whereas that's not where we should go first. What we should go first is to say everyone has capacity to make decisions. The question is how much support do they need to do that?
Okay. And that's where supportive decision making comes in. But like, who has the right, if I'm on a guardianship order and I was non-verbal, who has the right to tell my story if something's going wrong? Because that's the, and I don't expect you to have an answer. I don't, but that's the crux of it. Like, what happens if people do need to be defended from, stuff, and, it does get messy and dicey if someone spoke out. Who has the right to tell that story? What happens if a person with disability has been financially abused and they, came from their mum or their dad or their sibling? Like, do you just silence everyone, and the person doesn't have the right to get justice because they can't talk?
Yeah, well, I mean, I guess there's two different parts to that. So one is I'm not, as I said before, I'm not saying we don't need guardianship laws at all. I'll let other people have that debate.
Proportionate.
We do see people who are abused by people taking advantage and making decisions on their behalf, and it might be to do with finances, for example, where we see people close to them maybe taking advantage of inequalities in communication or decision making and saying, okay, I'm going to take advantage of that financially. That bothers us, and the choice in those situations is not between substitute decision making and supported decision making. It's abusive substitute decision making, and maybe substitute decision making that is legal and accountable to the courts and ethical through the Guardianship Act. So it's a choice between good and bad substitute decision making in those cases. But even in those cases, our goal should always be to put the will and preferences of the person first, and that applies whether they can speak or not. Everyone has a way of communicating, and our job is to understand what it is that they're saying and what it is they're communicating and what their will and preferences are, and that applies whether a guardianship order is in place or not.
I'm sitting down with Claire Robbs, the CEO of Life Without Barriers, in March, and they put out a position statement as well. What do you think the media's responsibility is around reporting these cases that are sensitive? Like, I don't think they do a great job, the media, sometimes.
No, I mean the media has ethical and legal responsibilities, not only to the person who's telling the story, but perhaps to other people who are implicated in the stories as well. And I appreciate that, but the solution for that is not to prevent people with disabilities or people subject to orders from telling their story. It's about managing the reporting in such a way that everybody is protected. So and there's ways they can do that, and they've managed to do that in many other situations. So they should be able to do that here.
All right. What are you looking forward to in the new year, and what's Yooralla going to get up to? You go to Japan first.
Well, I'm hoping for a holiday next year. That's right.
What else?
Well, Yooralla's looking forward to getting on with the recommendations from the Royal Commission and the NDIS review. So that includes expanding our choices and services. So I'll give you an example about employment. Is we have new social enterprises offering people award wages, working in the community. We've got employment coaches supporting individuals to go out and get mainstream employment at award wages. We're looking forward to those programs going on and expanding next year and offering a greater range of choices. That's just one example of things we're looking forward to doing next year, getting on with recommendations. It's a great time, to be in the sector. There's a lot of good advice we've had about directions for change. We agree with those directions and we're looking forward to putting them into practice.
I was going to say what else, because it's a bit cliche, but there is 6,000 pages, so it'll keep you busy.
It will keep us very busy. It won't just be next year, Uli.
200 recommendations.
That's right.
You just pick something.
Plenty of work to get on with, Uli, and look forward to your help with that as well.
Awesome. Thank you for sitting down with me.
Oh, it's been great, Uli. Thank you so much for the opportunity.
We need to do this sometime next year.
Yeah.
See what else we can talk about.
That'd be great. Happy to talk about employment next year.
Why not?
Yeah.
Yeah.
Great. It's a date.
All right.
Thanks, Uli.
Thank you. Have a good day.
You too.